Ed Paget here. Did you know that your lumbar spine pain, or even the pain you have in scoliosis, could be affected from something below the spine or even something above the spine? In this video, I'm going to explain exactly what I mean by that. Most clinicians, so physiotherapists, chiropractors, doctors, back pain experts, look at the spine when there's pain in the spine. For example, if I have pain in my lower back, they will focus in on that lower back, but they don't take a step back and look at the whole body to see what else could be affecting the lumbar spine. Now, as you may know, I try and empower the people I work with to look at their body as a complete unit, about how something somewhere else in their body could be affecting their lumbar spine. But I even take that a step further, and I ask people to look at their lifestyle and see how that could be affecting the way their spine works. I call this using lifestyle as their medicine. All right, I want to give you two examples of how two areas in the body could be affecting the lumbar spine. Now, I've seen prominent physicians say things like back pain is the price we pay for standing upright. And they are right, but with one big caveat. Back pain is the price we pay for standing upright if we have tight hips, tight thorax, and poor motor patterns. But that's not quite as catchy, so I understand why they say what they say. All right, so if we're looking at the lumbar spine and we have back pain here, we're not sure what the cause is. Let's say they've had an x-ray and they've seen arthritis on the facets, or they've seen bone spurs. Maybe they've even had an MRI and they've seen a disc bulge or something like that. That tells us what's causing the pain, but it doesn't tell us what led to that in the first place. So I would look at the hips. The hips should move freely, left and right, rotate both ways, and forwards and backwards. I have some other videos where I go into how to assess the hips, so feel free to watch those and to compare side to side. But I want to explain to you in this video why it's important. So these big hip joints are designed to move in all of those planes of movement. If they don't, the lumbar spine, which is a smaller area of the body, sits just above the pelvis, and it will try and do the job of the hips. So for example, if I am tight here in hip extension and I cannot take my hip behind me, my lumbar spine will extend. But if we're walking the recommended 6,000 to 10,000 steps a day, it doesn't take long for that lumbar spine to become worn out and chewed up because the hip isn't doing its job. Now, if we look above the lumbar spine, we have the thoracic spine. The thorax will do the same thing, move both ways, rotate both ways, and flex and extend. But if we spend a lot of time sitting, this thoracic spine will get tight, along with the hips from sitting. And so it will then ask the lumbar spine to do more work as well. I want to show you how to assess this. So one of my favorite ways is to take a stick, and we put that on the shoulders, and we say, okay, thorax, can you bend both ways equally? Now, if I went this way and I only went this far, and I went this way and I went this far, it will be obvious to me that the side bending to my left isn't as far. Same with rotation. We can hold the hip still here, standing, or we can try and hold the hip still with sitting down to be slightly more accurate with movement into the thorax. We want to see, does one side move a little bit? Does one side move a lot? And if there is, we have an imbalance. And lastly, we have flexion and extension. This one we can't compare side to side, but we can just look at the general movement. However, a lot of people who have a tight thorax will look equal both ways, equally tight, I like to say. But we can actually bring out dysfunction by combining some of those movements. So we can actually rotate a little bit, then add in side bending, and compare that movement to the other side. Or we can add in side bending first and then add in rotation and see how that looks. If you find a difference between sides, I actually have another video on how to mobilize your thoracic spine using one of these poles, which you can watch as well. So once we've looked at the hips and the thorax, and we've found differences from side to side, we then know why that lumbar spine had been asked to work harder than it should, and why it essentially started to break down and cause pain. But there is a wider question as well. If we think of just this posture causing tightness in the hips and tightness in the upper back, we could also look a little bit wider and look at the feet and ankles, and maybe they're affecting the way the hip works. Or we can go above the thoracic spine and look at the neck, and maybe that's affecting the way the thoracic works. So we can actually go wider as well, but then we can go wider into the person's life as well. Why is it that they're working in this position so much? Why aren't they taking breaks? Why aren't they mobilizing their body? Why aren't they walking and exercising to keep their body mobile, open, and flexible? So those are questions I would ask my clients when working on them around their lifestyle. What is it in their lifestyle that could be affecting their lower back pain? If you appreciate what I'm saying in these videos, don't forget to like and subscribe. But also share this video with someone who you think could benefit from taking a wider approach to their lower back pain or their scoliosis pain.